Welcome to Part 2 for the Providence Sacred Heart Kidney Pre-Transplant Education. Where do kidneys come from for kidney transplant? Kidneys can come from two different types of donors. Either living donors, which would be related, like a parent, a child, or maybe a sibling, or someone unrelated to you, such as a friend, a coworker, or maybe someone you don't even know. The other kind is a deceased donor. These are individuals who have passed away and had previously agreed to donate their organs, or their family members have decided to have their organs donated on behalf of their family member. Now we will hear about living donor donation from our living donor coordinator.
For the next several slides, I will be discussing an overview of how living donor evaluations work for our transplant program. Just because someone wants to donate a kidney does not mean that they will be determined to be a suitable candidate to do so. There is an age criteria for who can donate. For our program, the upper age limit is 65. If the living donor is someone who knows you personally, they can begin evaluation as young as 18. Body mass index, or BMI, is also a criteria that is used to determine beginning evaluation for a donor. The donor's BMI must be between 18 and 35 to be evaluated for living donation. Diabetes can be a cause of kidney disease, and because of this, donors must not have a diagnosis of diabetes and have no history of gestational diabetes. Also, high blood pressure is the second leading cause of kidney disease and kidney failure. Given this, blood pressure is looked at very closely and may cause a donor to be an unsuitable candidate. Living donors need to be healthy overall. Part of this process of becoming a potential living donor is to evaluate if two people can live well with one kidney. Let's talk about what your donors can expect once they have come forward to be evaluated and have cleared the initial screening. They will receive an in-depth and ongoing education as to the medical and psychosocial risks and potential complications to both them as the donor as well as you as a recipient. They will also be made aware of their post-operative restrictions as well as their ongoing care needs post-donation. Their donor evaluation will include a medical records review, psychosocial and psychological evaluation, and medical evaluation including labs and testing. Blood type compatibility and final cross-match compatibility are completed, but do not require a match for your donor to still be able to donate on your behalf. If they are not compatible, they may still donate on your behalf through the paired donation process. We will review the process of paired donation on the next slide. Additionally, a physical examination by our transplant nephrologist and surgeon and visits with the entire transplant team will be completed as well as being presented to the transplant committee. The transplant committee is a large group of many healthcare disciplines that gather on a regular basis to review both donor and recipient candidates. It is at this committee that the final determination is made as to whether a donor is considered suitable for donation through our program. So in paired donation, this typically occurs when there are two pairs, both a donor and a recipient, who are not compatible. For example, in this scenario, donor 1 wanted to donate to recipient 1. However, they are not blood type compatible. Donor 2 wanted to donate to recipient 2. However, they are not blood type compatible. Further testing revealed that donor 1 was compatible with recipient 2, and donor 2 was compatible with recipient 1. Given this, if all individuals are in agreement to the paired donation process, it can be arranged for donor 1 to give to recipient 2 and for donor 2 to give to recipient 1. This allows both donors to donate on behalf of their recipients. It also allows for both recipients to receive a kidney. It is important to note that being matched in a pair can take more time than traditional compatible donation. However, if your donor is not compatible with you, it does not automatically mean that your donor could not still donate on your behalf based on compatibility. Keep in mind that there still could be other items that may rule them out as a suitable candidate. So once the donor is cleared to donate at transplant committee and both the donor and recipient have received final clearance to have surgery, then surgery can be scheduled. The surgery for the donor is performed laparoscopically with 3 small incisions and 1 larger incision made in the abdominal area to bring the kidney out of the body. There is always a potential that the donor will have to be opened with traditional incisions if the laparoscopic surgery cannot be completed for some reason. The donor will sign a consent for both options deemed necessary by the surgeon. The donor will typically be in the hospital for 3 to 5 days after surgery. If the donor does not live locally, they will need to stay in the area until at least 1 week after discharge for a follow-up appointment with a surgeon who will clear them to return home. The donor will also be on lifting restrictions of 10 pounds, no more than 10 pounds, for 6 weeks, and will be off work for 4 to 6 weeks or longer, depending on their type of work. And if you think about 10 pounds, that's a gallon of milk, so not much lifting for those 6 weeks. As a donor, there is no cost for the evaluation or surgery, as these are covered either by our transplant program or through your insurance. Costs for the donor will be any travel that they may have when coming to Spokane. They will also need to cover any lodging or meals that they may incur. The lost wages for missing work will be their expense, as well as potential child care costs that may be needed if they will need help with young children during their recovery. Follow-up and/or future costs related to health care or otherwise would also be on the donor with their own insurance. Please note that when a living donor comes forward designated to donate to you, none of your health care information is shared with them. They are only notified if you are able to start having living donors evaluated or not. If not, they are not informed as to why. Please also note that when a living donor comes forward designated to donate to you, none of their information can or will be shared with you. Given this, communication between you and your donors is highly encouraged. Some recipients make their need known via social media or other types of media. This would include examples like Facebook, newspaper stories, news stories on television, etc. These are good sources of reaching a large audience with your need. However, there are a couple of important items to note if you choose to use this venue. Please share your need honestly and approach your story with why you don't like dialysis, if applicable, or how it impacts your life. Please do not say it is life-saving. Transplant is considered an elective surgery and a treatment option for kidney failure, not a life-saving event. It is in your best interest to present it as such. When it is presented as life-saving, donors will approach donation and evaluation with that mindset and intent. And when they are educated otherwise, they can become frustrated and even lose interest in the process. Please also wait until you have been seen in the clinic and had appointments with the transplant team, including the physician and the surgeon, prior to running such a campaign. We will not typically begin your donor evaluations until these appointments have happened. Again, a large volume of donors coming forward and being told that they will have to wait can cause them to lose interest. Although your donors can come forward at any time in your process, running large public campaigns such as these can generate quite an interest. The timing in which they are completed has impact on the outcome of the potential donor's motivation for staying in the evaluation process. Your donors can begin the process of being considered as a living donor by going to the website indicated on this slide, as well as by looking on the postcards you have in your packet for living donors. They will receive instructions for each step on how to proceed. For the remainder of this educational session, you will hear from one of the pre-coordinators who will finish explaining your workup and evaluation. If you have any living donor related questions, please feel free to call our clinic and we would be happy to help answer your questions.
There are two types of deceased donors. There are brain dead donors that have been legally declared brain dead according to state law. Brain dead donors are neurologically tested for brain death, scheduled for surgery, and taken to the OR and organs retrieved. The second kind is deceased after cardiac death donors. These display minimal brain function, have no chance of recovery, and are on a ventilator. Because DCD donors are on life support and not expected to survive, their family has chosen to withdraw life support and donate their organs. In this case, the donor is taken to the OR and support is withdrawn. There is a time limit for expiration, and if the time is exceeded, then the organs are no longer viable for transplant. We will let you know at the time of an offer what type of donor it is. The Kidney Donor Profile Index score, or KDPI, is a score that helps us classify kidneys. This score is a percentage that ranges from 0 to 100. It is associated with the quality of the kidney and how long we anticipate it will function. The score is based on facts about the donor, such as age, height, weight, cause of death, history of high blood pressure and diabetes, also serum creatinine. A score of greater than 85% is considered high. These higher percentage KDPI kidneys are predicted to not last as long as a lower scoring kidney. However, you may not have to wait as long if you are willing to accept one of these higher KDPI kidneys. Our surgeon will discuss this with you during your evaluation to determine if you would be a good candidate for a higher KDPI kidney. He will have you sign a specific consent. Signing the consent does not mean that you cannot receive offers of lower scoring kidneys. It just means that you are willing to consider higher scoring offers. For further details, please see the handout provided for you in your education packet, or you may also ask your nurse coordinator. Each donor, whether living donor or deceased donor, is tested with sensitive testing for HIV, hepatitis B, and hepatitis C. While the tests we use are considered very good, as with every test, there is a small chance the test is negative even if the virus is present. A negative test might occur if the donor had a very recent infection. We identify donors who have potential exposures in the last month that might be missed by testing. However, consider that your chance of dying while waiting for another organ may be greater than the risk of infection. The risk of missing an infection is around 1 in 10,000 to 1 in a million, depending on the risk criteria. While the risk is very low, a small risk does exist. All recipients will be tested for these viruses after transplant as part of our protocol. Now that we have reviewed evaluation, committee, waitlist, and kidney offers, we need to talk about something that's very important to the success of your kidney transplant, the post-transplant plan. After transplant, it will be required that you stay in Spokane for approximately 3 to 4 weeks. After transplant, you can expect to be in the clinic about 3 times a week for education, lab draws, frequent medication changes, and physician visits. It is vitally important that you have a person with you that you can rely on and that can be here with you for those 3 to 4 weeks. And another thing to think about is, where are you and your support person going to stay for the required time? Do you have enough funds for gas, meals, and lodging? Our financial coordinators will be working with you prior to transplant to help make sure you have a plan. Transplant centers are required to publish their outcomes every 6 months. Outcomes for all transplant centers across the country are available at www.srtr.org. Outcomes include data on transplanted kidneys and patient survival. Living donor kidney transplants have the best outcomes. You will be provided our center's current outcomes when you come here for your team visit, and there is also one available in your education packet. Communication with us here at Providence Sacred Heart Kidney Transplant is extremely important. Please notify us if you have a change in your health, such as a hospitalization, a surgery, or an infection, or if you have a change of address or phone number so we can reach you, or if you have a change in your insurance. If you are traveling for any length of time that may impact a kidney transplant offer for you, please let us know so we can assist you. This concludes your pre-kidney transplant education. Thank you for your time, and we are excited to help you with your next steps. If you have questions or need to contact us, please call us at 509-474-4500 or 1-800-667-0502.